The earliest symptom of measles infection is option A skin rash, option B cough and coryza, option C Koplik spots, option C conjunctivitis. The correct answer is option B cough and coryza. Measles typically begins with a fever, cough, coryza, and conjunctivitis before the rash appears. Koplik spots are diagnostic of option A chickenpox, option B measles, option C rubella, option D mumps. The correct answer is option B measles. Koplik spots are small bluish white spots on the buccal mucosa seen in measles before the rash erupts. Par- Parotid gland swelling is a characteristic of option A rubella, option B measles, option C mumps, option D chickenpox. The correct answer is option C mumps. Mumps virus infects the parotid gland leading to painful facial swelling. Parotid gland swelling is a characteristic sign of mumps. A sandpaper like rash is typical of option A rubella, option B measles, option C scarlet fever, option D rubella. The correct answer is German measles. The correct answer is option D, rubella, German measles. Rubella causes fine pink rash resembling sandpaper starting on the face and spreading. Jaundice is a common sign of option A HIV, option B hepatitis virus infection, option C influenza, option D mumps. The correct answer is option B hepatitis virus infection. Liver inflammation by hepatitis virus AE leads to yellowing of skin and eyes, jaundice. John, which viral infection shows bull-neck appearance? Option A measles, option B mumps, option C influenza, option D dengue. The correct answer is option B mumps. Severe mumps may cause bilateral parotid swelling, giving a bull-neck appearance. Maculopapular rash appearing after fever subside is seen in option A dengue, option B measles, option C chickenpox, option D rubella. The correct answer is option A dengue. In dengue fever, the rash often appears when the fever drops and recovery begins. Which of the following signs is seen in chickenpox? Option A rash in crops, option B Koplik spots, option C parotid swelling, option D jaundice. The correct answer is option A rash in crops. Chickenpox rash appearance assess successive crops at different stages: papules, vesicles, and crusts. Papules, vesicles, and crust. Strawberry tongue may be seen in option A measles, option B scarlet fever, option D Kawasaki disease, option D both B and C. Strawberry tongue occurs in scarlet fever and Kawasaki disease due to mucosal inflammation. The correct answer is option D, B and C. Pain behind the eyes is a classical sign of option A measles, option B dengue, option C influenza, option D rubella. The correct answer is option B dengue. Retroorbital pain, pain behind eyes is a distinctive feature of dengue fever. Pain behind the eye is a classical sign of dengue. Which viral disease present with vascular rash in dermatomal pattern? Option A measles, option B herpes zoster, option C rubella, option D mumps. The correct answer is option B herpes zoster. Herpes zoster causes vascular eruptions along a specific nerve dermatoma. Which of the following is a sign of rabies infection? Option A rash, option B hydrophobia, option C jaundice, option D parotitis. The correct answer is option B hydrophobia. Rabies causes painful spasms of throat muscles leading to fear of water, that is hydrophobia. The sign of rabies infection is hydrophobia. Oral hairy leukoplakia is a sign of option A influenza, option B HIV infection, option C measles, option D mumps. The correct answer is option B. Oral hairy leukoplakia is caused by Epstein-Barr virus in immunocompromised patient. Which viral disease causes microcephaly in newborns? Option A Zika virus infection, option B rubella, option C dengue, option D cytomegalovirus infection. The correct answer is option A. Zika virus crosses the placenta and damages fetal brain, leading to microcephaly. The slapped cheek appearance is typical of option A measles, option B paravirus B19 infection, option C mumps, option D rubella. The correct answer is option B paravirus B19 infection. Paravirus B19 causes erythema infectosa, producing red cheeks that look slapped. A painless genital ulcer followed by lymphadenopathy suggests option A HSV1, option B HSV2, option D HPV, option D HIV. The correct answer is option B herpes simplex virus type 2 Commonly causes genital herpes with ulcers and swollen lymph nodes. Which viral infection shows dew drops on a rose petal rash? Option A chickenpox, option B measles, option C rubella, option D mumps. The correct answer is option A chickenpox. The vascular rash of chickenpox resembles clear dew drops on a red base like rose petal. Which virus infection shows post-auricular lymphadenopathy? Option A measles, option B rubella, option C mumps, option D influenza. Correct answer is option B rubella. Characteristically causes swelling of lymph nodes behind the ear. Rubella characteristically causes swelling of lymph nodes behind the ears. Which sign is seen in cytomegalovirus infection in infants? Option A microcephaly, option B rash, option C cough, option D oral ulcers. The correct answer is option A microcephaly. Congenital CMV causes microcephaly, jaundice, and hepatosplenomegaly. Conjunctivitis with fever and rash suggests option A influenza, option B measles, option C rubella, option D mumps. The correct answer is option B measles. Measles causes fever, rash, and conjunctivitis as part of its prodromal phase. Conjunctivitis with fever, rash called measles. Generalized lymphadenopathy is a hallmark of option A influenza, option B HIV infection, option C mumps, option D measles. The correct answer is option B HIV infection. Persistent generalized lymph node enlargement is an early sign of HIV infection. Generalized which viral infection leads to jaundice and clay colored stools? Option A hepatitis A, option B measles, option C mumps, option D dengue. The correct answer is option A hepatitis A. Hepatitis A causes jaundice, dark urine, and pale stool due to liver involvement. A target lesion rash is seen in option A measles, option B herpes simplex, option C erythema multiforme, option D rubella. The correct answer is option C erythema multiforme. Erythema multiforme often triggered by HSV present with concentric ring target lesions. Okay. Which viral disease causes hemorrhagic manifestations like gum bleeding and nose bleeds? Option A influenza, option B dengue, option C rubella, option D mumps. The correct answer is option B dengue. Severe dengue infection damages blood vessels leading to bleeding from mucous membranes. Which viral infection may show all-eye inclusion bodies in cells? Option A CME infection, option B rubella, option C measles, option D HIV. The correct answer is option A CME infection. CME causes characteristic nuclear inclusion bodies that appear like all-eyes under microscopy. Which viral infection present with orchitis testicular swelling? Option A measles, option B mumps, option C rubella, option D chickenpox. The correct answer is option B mumps. Mumps virus can infect the testes causing painful inflammation known as orchitis, especially in post-pubertal males. A hairlard patch followed by multiple oval lesions is seen in option A measles, option B rubella, C pityriasis rosea, option D herpes simplex. The correct answer is option C pityriasis rosea. Pityriasis rosea, often viral in origin, begins with a hairlard patch followed by secondary eruptions on the trunk. A vascular rash limited to one side of the body is a sign of option A measles, option B herpes zoster, option C rubella, option D chickenpox. The correct answer is option B herpes zoster. Herpes zoster affects the sensory nerves, producing a unilateral lash along dermato. Which viral disease causes facial paralysis, Bell's palsy? Option A HSV1 infection, option B measles, option C rubella, option D dengue. The correct answer is option A HSV1 infection. Reactivation of herpes simplex virus can lead to inflammation of facial nerves causing Bell's palsy. The characteristic sign of hand, foot, and mouth disease is option A rash on palms and soles, option B parotid swelling, option C rash on trunk only, option D coptic spots. The correct answer is option A rash on palms and soles. Coxsackie virus infection causes vascular lesions on hand, feet, and mouth of children. Ground glass appearance in hepatocytes is a sign of option A hepatitis A, option B hepatitis B, option C hepatitis C, option D hepatitis D. The correct answer is option B hepatitis B. Hepatitis B infection shows ground glass cytoplasmic inclusions due to surface antigen accumulation. Severe muscle pain with high fever is typical of option A dengue, option B mumps, option C rubella, option D hepatitis. The correct answer is option A dengue. The severe body and muscle pain seen in dengue is why It is called breakbone fever. Breakbone fever. Swelling of the submandibular gland may occur in option A measles, option B mumps, option C rubella, option D chickenpox. The correct answer is option B mumps. Mumps virus infects salivary glands including parotid and submandibular gland causing facial swelling. Which sign is seen in congenital rubella syndrome? Option A microcephaly, option B rash, option C orchitis, option D paralysis. The correct answer is option A microcephaly. Congenital rubella leads to microcephaly, cataracts, and cardiac defects in newborn. Congenital rubella leads to microcephaly, cataracts, and cardiac defects in newborns. Blueberry muffin rash in infant suggests option A dengue, option B rubella, option C measles, option D mumps. The correct answer is option B rubella. Congenital rubella causes purplish skin lesions from extramedullary hematopoiesis called blueberry muffin rash. Which viral infection shows all eye inclusion bodies microscopically? Option A CMV infection, option B rubella, option C mumps, option D measles. The correct answer is option A CMV infection. Cytomegalovirus infection shows large intranuclear inclusions known as all-eye cells. Swimmer's ear due to viral origin is rare but can occur in option A adenovirus infection, option B measles, option C rubella, option D hepatitis. The correct answer is option A adenovirus. Adenovirus can cause otitis externa or swimmer's ear leading to ear pain and discharge. Which viral infection present with bilateral parotid swelling and fever? Option A mumps, option B measles, option C rubella, option D herpes simplex. The correct answer is option A mumps. Mumps typically causes bilateral parotid swelling with fever. Malaise. Mumps typically causes bilateral parotid swelling with fever and malaise. Jaundice and dark colored urine are classical signs of option hepatitis infection, option B measles, option C HIV, option D rubella. The correct answer is option A hepatitis infection. In hepatitis, liver disinfection leads to bilirubin buildup causing jaundice and dark urine. Jaundice and dark colored urine are clinical sign of hepatitis infection. Rash that starts on face and spreads to body within 24 hours is typical of option A rubella, option B measles, option C chickenpox, option D dengue. The correct answer is option A rubella. Rubella rash begin on the face and rapidly spread downward to body. Which viral disease shows vesicles on the lips and mouth? Option A HSV1 infection, option B rubella, option C mumps, option D measles. The correct answer is option A HSV1 infection. Herpes simplex virus type 1 causes cold sores and vesicles around lips and oral mucosa. Or which viral infection commonly causes diarrhea in infants? Option A rotavirus, option B mumps, option C hepatitis, option D rubella. The correct answer is option A rotavirus. Rotavirus infection is a leading cause of severe diarrhea and dehydration in which virus cause rash and arthritis in adults? Option A parvovirus B19, option B mumps, option C dengue, option D rubella. The correct answer is option A. Parvovirus B19 can cause joint pain and arthritis-like symptoms in adults, especially women. Rash in different stages of healing at the same time indicates option A chickenpox, option B measles, option C rubella, option D mumps. The correct answer is option A chickenpox. Chickenpox rash appears in crops, showing papules, vesicles, and scabs simultaneously. Which viral infection shows subcutaneous hemorrhages and shock? Option A dengue hemorrhagic fever, option B measles, option C rubella, option D hepatitis. The correct answer is option A dengue hemorrhagic fever. Severe dengue infection damages capillaries leading to bleeding and shock. Severe itching after rash besides is feature of option A chickenpox, option B measles, option C rubella, option D mumps. The correct answer is option A chickenpox. Healing chickenpox lesions can cause intense itching as scabs form. Forchheimer spots on soft palate are seen in option A measles, option B rubella, option C chickenpox, option D mumps. The correct answer is option B rubella. Small red spots on the soft palate. Forchheimer spots appear early in rubella infection. Forchheimer spots on soft palate are seen in rubella. Which viral infection is associated with hepatosplenomegaly and typical lymphocytes? The correct answer is option A Epstein-Barr virus infection. Epstein-Barr virus infection causes infectious mononucleosis showing enlarged liver and spleen and atypical lymphocytes. In HIV infection, oral thrush is common caused due to option A immune suppression, option B viral replication, option C antibiotic overuse, option D vitamin deficiency. The correct answer is option A immune suppression. Due to weakened immunity, candida overgrows in the mouth of HIV patients causing stress. A lace-like rash on the body is seen in option A parvovirus B19 infection, option B measles, option C rubella, option D chickenpox. The correct answer is option A parvovirus B19 infection. Parvovirus B19 causes erythema infectosum with reticular or lace-like rash on which viral disease shows a biphasic fever pattern? Option A measles, option B dengue, option C mumps, option D rubella. The correct answer is option B dengue. Dengue fever often present with a biphasic pattern, an initial high fever, short remission, and then a second fever spike. Which sign is commonly associated with Ebola virus infection? Option A rash, option B hemorrhage, option C jaundice, option D cough. The correct answer is option B hemorrhage. Ebola causes severe internal and external bleeding due to vascular damage and coagulopathy. Hemorrhage, enlargement of cervical lymph nodes with a sore throat suggest. Option A measles, option B Epstein-Barr virus infection, option C rubella, option D mumps. The correct answer is option B Epstein-Barr virus infection. Infectious mononucleosis from ABV typically causes cervical lymphadenopathy with sore throat and fatigue. Which viral infection leads to whitish vesicles on tonsils? Option hyperangina, option B measles, option C rubella, option D mumps. Coxsackie A virus causes hyperangina characterized by small whitish vesicles on the tonsillar pillars. Rash is starting from trunk and spreading to limbs is seen in option A measles, option B chickenpox, option C rubella, option D dengue. The correct answer is option B chickenpox. In chickenpox, the rash begins on the trunk and face before spreading to limbs. Rash starting from trunk and spreading to limbs is seen in option B chickenpox. In chickenpox, the rash begins on the trunk. Painful oral ulcers recurring periodically suggest infection with option A HSV1 virus, herpes simplex virus type 1, option B rubella, option C mumps, option D measles. The correct answer is option A. Herpes simplex virus type 1 causes recurrent painful oral ulcers known as recurrent herpes labialis. A patient present with fever, rash, and joint pain most likely cause option A dengue, option B chikungunya, option C rubella, option D measles. The correct answer is option B chikungunya. Chikungunya virus infection causes fever with severe joint pain and rash lasting weeks. Which viral infection shows jaundice with severe itching? Option A hepatitis C, option mumps, option C measles, option D HIV. The correct answer is option A hepatitis C. Hepatitis C causes jaundice, fatigue, and intense itching due to bile accumulation. Viral infection shows jaundice with severe itching is option A hepatitis E. Enlarged posterior cervical lymph node with rash or seen in option A measles, option B rubella, option C chickenpox, option D mumps. The correct answer is option B rubella. Rubella typically present with post-auricular and posterior cervical lymphadenopathy along with a mild rash. Sudden high fever with rash and drop in platelet count indicates option A dengue, option B mumps, option C rubella, option D influenza. The correct answer is option A dengue. Dengue fever leads to thrombocytopenia, low platelet count, rash, and hemorrhagic tendencies. Sudden high fever with rash, drop in platelet is dengue. Which viral infection present with vesicles on lips and gums in children? Option A HSV1, option B rubella, option C measles, option D chickenpox. The correct answer is option A. Primary herpes simplex infection in children causes gingivostomatitis with vesicles and ulcers in the mouth. Chronic cough with weight loss in HIV patients suggest option A CME infection, option B tuberculosis secondary infection, option C measles, option D rubella. The correct answer is option B tuberculosis. Immunocompromised HIV patient commonly develop TB as an opportunistic infection. Which viral infection leads to painful blisters on the genital area? A. HSV2, option B. HPV, option C. Rubella, option D. Measles. The correct answer is option A. Herpes simplex virus type 2 causes recurrent painful vascular lesions on genital mucosa. Which viral infection present with petechial rash and shock? Option A, dengue, hemorrhagic fever. Option B, measles. Option C, rubella. Option D, hepatitis. The correct answer is option A. In severe dengue, capillary leakage causes petechia, bleeding, and shock. Viral infection present with a patient develops swelling near ear, headache, and jaw pain. Likely cause. Option A, mumps. Option B, rubella. Option C, measles. Option C, dengue. The correct answer is option A, mumps. Mumps infection of parotid gland leads to facial swelling and jaw pain. Mumps causes swelling near ear, headache, and jaw pain. Which viral disease may cause congenital cataracts in newborn? Option A, rubella. Option B, Zika. Option C, CMV. Option D, measles. The correct answer is option A, rubella. Congenital rubella syndrome causes cataracts, deafness, and heart defects in infants. Viral infection disease cause congenital cataracts is rubella. Cowrie type A inclusion bodies are characteristic of option A, Herpes simplex virus, infection. Option B, measles. Option C, rubella. Option D, mumps. The correct answer is option A, herpes simplex infection. HSV infection shows intranuclear Cowrie type A inclusions on microscopic examination. Which viral infection may lead to hepatomegaly and splenomegaly? The correct answer, the options are option A, EBV infection. Option B, measles. Option C, rubella. Option D, HIV. The correct answer is option A, EBV infection. Infectious mononucleosis due to EBV causes enlargement of both liver and spleen. Epstein-Barr virus. A generalized rash followed by skin peeling is seen in option A, staphylococcal scalded skin. Option B, measles. Option C, toxic shock. Option D, none of this. The correct answer is option D, none of this. Generalized peeling desquamation is not a viral sense, it is a bacterial, thus not fits viral causes. The classic sign of influenza infection is option A, coryza and sore throat. Option B, rash. Option C, jaundice. Option D, lymphadenopathy. The correct answer is option A, coryza and sore throat. Influenza virus causes fever, cough, sore throat, and nasal discharge. Coryza, not rash. The classic sign of influenza is coryza. Which viral disease shows Koplik spots before rash? Option A, measles. Option B, rubella. Option C, mumps. Option D, chickenpox. The correct answer is option A, measles. Koplik spots on the buccal mucosa appear in measles 1 to 2 days before the rash. Virus shows Koplik spots before rash is measles. Swelling of lacrimal glands causing dry eyes and mouth is seen in option A, HIV. Option B, mumps. Option C, rubella. Option D, influenza. The correct answer is option B, mumps. Mumps can involve lacrimal and salivary glands causing eye dryness and discomfort. Mumps causes swelling of lacrimal glands. Which viral infection may show yellow eyes and tea-colored urine? Option A, hepatitis A. Option B, measles. Option C, dengue. Option D, rubella. The correct answer is option A, hepatitis A. Hepatitis A causes jaundice, dark urine, and fatigue due to liver inflammation. Hepatitis A causes tea-colored urine. A patient with HIV develops multiple purple skin nodules cause. Option A, CME virus. Kaposi sarcoma, HHV8. Option C, rubella. Option D, measles. The correct answer is option B, Kaposi sarcoma. Kaposi sarcoma caused by human herpes virus 8 appears. Which viral infection can lead to paralysis following fever? Option A, poliovirus infection. Option B, mumps. Option C, measles. Option D, rubella. The correct answer is option A, poliovirus infection. Poliovirus infects motor neurons in the spinal cord, leading to flaccid paralysis after fever subsides. Poliovirus infection leads to paralysis with fever. Which viral infection causes recurrent vesicles on the lips during stress? Option A, HSV1. Option B, rubella. Option C, mumps. Option D, measles. The correct answer is option A, HSV1. Herpes simplex virus type 1 reactivates during stress or fever, causing cold sores on the lip. HSV1 causes vesicles on the lips. A maculopapular rash beginning behind the ear is seen in option A measles, option B rubella, option C chickenpox, option D dengue. The correct answer is option A measles. Measles rash typically starts behind the ears and spread to face, trunk and lips. Severe conjunctivitis with photophobia is characteristic of option A measles, option B mumps, option C rubella, option D dengue. The correct answer is option A measles. Measles virus cause eye dryness and photophobia due to inflammation of the conjunctiva. Measles causes severe conjunctivitis with photophobia. Which viral infection can cause deafness as a complication? Option A mumps, option B rubella, option C measles, option C dengue. The correct answer is option A mumps. Mumps can cause sensory neural hearing loss due to involvement of cochlear nerve. Mumps cause deafness as a complication. Fever with rash and tender lymph nodes suggest option A rubella, option B measles, option C dengue, option D chickenpox. The correct answer is option A rubella. Rubella infection present with mild fever, rash and tender post-auricular or occipital lymphadenopathy. Fever with rash and tender lymph nodes suggest rubella. Which sign indicates severe dehydration in rotavirus infection? Option A dry mouth and sunken eyes, option B rash, option C parotid swelling, option D jaundice. The correct answer is option A dry mouth and sunken eyes. Rotavirus causes water diarrhea leading to dehydration reflecting by dry mucosa and sunken eyes. A pregnant woman infected with rubella in early pregnancy may give birth to an infant with option A microcephaly, option B cataract, option C heart defect, option D all the above. The correct answer is option D all the above. Congenital rubella syndrome includes microcephaly, cataract and congenital heart disease. Which viral disease cause Ol's eye inclusion in nucleus? Option A CMV infection, option B HSV infection, option C measles, option D mumps. The correct answer is option A CMV infection. Cytomegalovirus produces large intranuclear inclusions called Ol's eye bodies on histology. CMV infection causes Ol's eye. A child presents with red eyes, runny nose and rash likely disease. Option A measles, option B rubella, option C mumps, option D chickenpox. The correct answer is option A measles. The classic trait of cough, coryza and conjunctivitis with rash indicates measles. Which sign is a characteristic of hepatitis C virus infection? Option A chronic liver disease, option B acute jaundice, option C rash, option C parotitis. The correct answer is option A chronic liver disease. Hepatitis C often causes chronic infection leading to liver fibrosis and cirrhosis rather than acute jaundice. Characteristic of hepatitis C is chronic liver disease. Sudden onset of fever with joint stiffness and rash is seen in option A chikungunya, option B dengue, option C measles, option D rubella. The correct answer is option A chikungunya. Chikungunya virus causes severe joint pain and swelling, often with a rash. Sudden onset of fever with joint stiffness is called and rash is called chikungunya. Painful blisters along with the genital area appear repeatedly. Option A HSV 2, option B HPV, option C rubella, option D mumps. The correct answer is option A. Herpes simplex virus type 2 causes recurrent and genital herpes with painful vesicular eruptions. Which sign is common in both measles and rubella? Option A maculopapular rash, option B Koplik spots, option C hemorrhage, option D jaundice. The correct answer is option A. Both infections cause maculopapular rashes, but Koplik spots are specific to measles. Which sign is common in both measles and rubella? Which viral infection may lead to swelling and pain in the ovaries? Option A mumps, option B rubella, option C measles, option D chickenpox. The correct answer is option A mumps. Mumps can cause oophorytis, inflammation of ovaries in post-pubertal females. Which viral infection may cause swelling and pain in ovaries? The correct Which viral infection is commonly associated with jaundice and malaise? Option A hepatitis B, option B rubella, option C mumps, option D measles. The correct answer is option A hepatitis A. Hepatitis A virus infects liver cells leading to jaundice, fatigue and loss of appetite. Hepatitis A virus associated with jaundice and malaise. A vascular rash limited to one side of face and body indicates option A Hep zoster, option B chickenpox, option C rubella, option D measles. The correct answer is option A Hep zoster. Hep zoster affects sensory nerves and causes rash restricted to one side dermatomal pattern. A. Ground glass appearance in liver biopsy is seen in option A hepatitis B infection, option B hepatitis A, option C measles, option D rubella. The correct answer is option A hepatitis B infection. Accumulation of hepatitis B surface antigen in hepatocytes gives a ground glass microscopic appearance in HBV infection. Pain in jaw while eating and swollen cheeks in a child indicates option A mumps, option B measles, option C rubella, option D dengue. The correct answer is option A mumps. Mumps infects salivary glands causing painful parotid enlargement worsened by chewing. Which viral infection presents with rash, fever and bleeding gums? Option dengue, hemorrhagic fever, option B measles, option C rubella, option D chickenpox. The correct answer is option A dengue hemorrhagic fever. Dengue hemorrhagic fever causes increased capillary permeability and bleeding manifestation. Dengue hemorrhagic fever present with rash, fever and bleeding gums. Rash on palms and soles is seen in which viral disease? Option A hand, foot and mouth disease. Option B measles, option C rubella, option D mumps. The correct answer is option A hand, foot and mouth disease. Coxsackie virus causes vascular rash on palms, soles and oral mucosa in children. Generalized itching without rash in a viral infection suggests option A hepatitis, option B measles, option C mumps, option D rubella. The correct answer is option A hepatitis. Hepatitis causes cholestasis and bile retention leading to itching even before jaundice appears. Hepatitis causes generalized itching without rash. Swollen glands behind the ear indicates option A rubella, option B mumps, option C measles, option D influenza. The correct answer is option A rubella. Rubella causes post-auricular and occipital lymph node enlargement early in the illness. Swollen glands behind the ears indicates rubella. Breakbone fever with severe muscle and bone pain is due to option A dengue, option B chikungunya, option C rubella, option D measles. The correct answer is option A dengue. Dengue is also called breakbone fever due to intense muscle, joint and bone pain. Dengue is also called breakbone fever. Which viral disease common leads to jaundice in pregnancy? Option A hepatitis C, option B hepatitis A, option C rubella, option D mumps. The correct answer is option A hepatitis E. Hepatitis C infection particularly severe in pregnant women and often causes acute liver failure. Hepatitis E infection can see in the pregnant woman. A viral disease showing subcutaneous bleeding, shock and high fatality is option A Ebola, option B rubella, option C mumps, option D measles. The correct answer is option A. Ebola virus infection presents with high fever, bleeding under the skin, organ failure and high mortality. Thank